Okay, so here we are, therapy number 3 for your shoulder.
Yeah.
So we've been working on fixing his sprained tendon in this area. So we're gonna continue. We're gonna see. You are back to CrossFit, right?
Yesterday was my first day.
So he's back to CrossFit.
I was modifying things, like instead of doing front squats, I did back squats, and instead of doing like something with shoulder, I did deadlifts. So I was holding like this.
Okay. Excellent. So it's important if you want to work out that you do modify your workouts so you can give the tendon a rest. We want to get you back in your sport as quickly as possible, but safely. All right. It is good that you go back and you do your routines, but we want to take you back safely. So let's see what his reaction is today.
All right.
All right. So we're gonna start here.
Okay.
So last time we were doing his therapy, we were looking at part of the deltoid, a little bit in the front deltoid and the middle deltoid. So again, just to repeat, we have 3 deltoid muscles: front, middle, and the posterior deltoid. Those all allow us to bring our shoulder up, okay, to do overhead movements. Very strong muscles, but they can get injured, as we saw with just bad technique, right?
Yeah, bad technique, very bad technique.
Not necessarily the weight, it's just bad technique, and that's how most people get hurt. They have poor technique, and then they lift too much, and
it could be a combination of trying to lift too much and bad technique.
That is also true, and I don't doubt it from this guy.
It was a combination of my ego.
All right, there you go. The truth speaks.
So, as far as pain, I tell you right now, that's 30% right there. I do feel the pain there. Okay. And I feel it goes from up and down 30 to 50.
Okay.
Yeah.
So we're going to see.
Not as painful as it was last time.
Perfect. And he seems to be tolerating it well.
Yeah.
At this moment.
It's still right there. It's still right there.
So what I do in this therapy is I'm also feeling for how the fibers are reacting. All right. So the best way I can explain it to you, again, this is like a wrinkled muscle, like a wrinkled shirt, and you got to iron it out. Whenever these fibers, they get injured, they wrinkle up, and we got to flatten everything out. That way the muscle can contract and do its thing. So as I'm going through here, I'm feeling, all right, are these muscle fibers in alignment, or are they still dysfunctional? And I can feel some of the dysfunction right there at the connection.
Yeah. But is that part of the bone, you think, or is that?
This is the fibers attaching to the bone.
All the fibers attaching to the bone.
The fibers of the muscle attaching right to the bone.
Okay, right? So it's like when you get a massage and you got a little lump, and they massage that so it could get flat. Is that kind of?
That's kind of it. Now that happens at the muscular level, but at the tendon. All right. So what we want to know is a little bit about basic anatomy. You have the bone, then you have the tendon, which is the white part, tough part, and then you have in the middle of the muscle you have your red fibers. So this is the muscle belly as we all know it, and then it connects to another bone again. So it goes tendon, muscle, tendon, and then it goes right to the bone. So that's how we're made up. So right now what we're working, yes, we're working some of the deltoid, but we're also working on that tendon connection. That's why this takes a little bit longer to heal. It's a combination of muscle and it's a combination of tendon. If it was only muscle, we'd get done with this rather fast, maybe 2-3 weeks. So, but we're looking good. We still getting a reaction here, and we'll do a close-up in a little bit. But you could see from last week's video, he's tolerating this quite well today.
Do you think that I'm a little sore. I feel that right there too, but that's probably from soreness. But I do
this
feel
is probably from lifting.
From the lifting.
Right now, as I'm going through, I'm getting the normal, just easy reaction, not much. So this is more likely from your soreness.
From your soreness, okay.
All right. This here is from your injury, right?
Yeah.
There. And it feels different, correct?
Yes.
All right.
Do you recommend I go today to work out after this?
You can.
Oh, I can?
You
Okay.
can. It's not a problem.
Okay.
As long as you're not abusing, all right? If you have an injury, you shouldn't work on top of that injury and abusing, because you're gonna injure more fibers and then it's gonna take you longer to heal. So that's what I tell my athletes here is proceed with caution. Use other muscle groups. Go do something else. Go work your triceps, go do your abs, go do your legs. There's plenty of other muscle groups.
Or like you said, don't do the same exercises
That
that
created
got me
your
hurt.
pain.
Correct. So I could still use this, but I could do deadlifts. I could lift from the bottom up, or lift like this,
Correct.
but not anywhere.
Not
on
that
top.
overhead top activity that created the injury in the first place. He's correct about that.
Okay.
See, Gizzy is learning good protocols.
I am. And you know what? It's you're aware. You become aware.
Correct.
When you go work out, you're like, you know what? Let me not do it that way, or let me not put that much of weight because it's not gonna. I already know. I've been there. Done
Don't let the ego take over, in other words.
Yeah. I still feel it right there, doctor.
Exactly. So this is pretty much, and now we can do a little close up. Why don't you get right close to the camera? It's less of a spot, almost not noticeable, but right there. Circle right in there. Very small region, so we know we're getting there. This is probably the most injured area.
What do you think? I feel like I'm 90%.
And I would say, looking at you here, you're about 80-85, so you're close.
Oh, 80-85.
You're 80-85%.
So still be patient.
Be patient. He's got probably another visit that I'm gonna do in this area, and then he's done. All right. Next week, I think we'll probably have either very, very mild redness that still signifies there's an active injury. But so far, what I'm seeing today is really good, very promising.
Okay, good. And then I could go back to lifting up or doing pull-ups.
Yep. Okay. Now, go back gradually. After every injury, every athlete needs to go gradually. You got to take moderate steps.
Okay.
You can't just go from being completely injured to going back to lifting the original weight you were before you're lifting. That's a dumb idea. Okay. So don't be dumb. Don't get egotistic and hurt yourself again because you want to start at the same place.
Yeah,
all right?
No way.
Moderate. That's it, Gizzy. Sometimes the ego gets to us, and then we want to lift more than we should.
That's what it is.
And then we mess ourselves up.
And then we mess ourselves up.
So here's a major point for all of you athletes. All right, you never want to sacrifice your form for weight. Bad idea. All right, if you're putting more weight and you're messing up your form, you're gonna get injured. So never sacrifice, all right, your form because you want to add more weight and you want to push more. Not a good idea because your joints are gonna pay for it.
Correct. That's so true.
That's what I
it's
tell
a
all the
humbling
athletes.
experience because coming from the gym to going into CrossFit is totally night and day.
Absolutely.
You know, they teach
Very
you different
challenging,
things.
yeah.
Yeah, very challenging. So, I mean, my thing was I could do it, but no, you can't do it.
Right. Now, let's have you turn this way. Yeah, allow the camera. So what I want you to do is just a slight motion up. There you go, and hold it right there.
Okay. Ooh.
So the next part of the therapy we do is we take this muscle in motion. We take it in the same plane of, and that will create a little bit of more pain. But I'm doing that on purpose so we can get the muscle activated to a great point.
Whoa.
So you feel it a little bit more, right?
Whoa, yes. But plus I'm sore too with everything. Oh.
Yeah, he's got a little bit of soreness here, so that's probably what he's feeling.
No, but I do. If you go right back up to where you were at before, right there.
You feel it, yeah.
Feel a little bit there.
Yeah. So we definitely have to take the thing about this kind of therapy is we do it in what we call an active state. And the active state is taking the muscle through a motion. All right, we have what we call a passive state and then the active state. Passive is his arm is just relaxed.
Okay.
And we do the therapy that way in the beginning. And then later on, as what I'm doing now, we do it in an active state to make sure that the muscle can react when he's going to go do his lifting.
Okay.
That's a big difference in how we do therapy now and even 10 years ago.
Oh, wow.
And we're almost done.
So you put more ointment on it so it could be smoother?
No, it's got enough. It's just, it's your muscle, my friend. It's not a lack of ointment.
Right there. Right there.
So during the active state, okay, if we get a little closer.
Wow, look at that.
Look what we found. All right, so we found an area down here that just needed to get loosened up. Not so bad. Okay, not so bad because this is in the muscle region, so this heals a lot faster. Okay.
Even if it's while doing the movement.
Correct. So here, because it's the muscle region.
Okay.
Right, it'll heal faster. There's more red blood cells that go in here, so a lot of faster healing here in the middle than here at the tendon junction.
Oh, okay.
All right, a little bit more and then we're done.
Oh man, not that bad, not that bad. How? You know something?
Right,
I
so
don't really feel it that much.
That's it for Gizzy today on his shoulder. We'll pick up next week. I think next week we should be wrapping it up. So again, Gizzy, you need to proceed with caution. All right.
Yes.
Exercise. I want your exercise, but don't abuse.
Don't abuse.
All right.
Go
until you get well,
into it.
then he can go 100%. All right.
Okay.
And then the next one is his ankle.
Yeah.
All right.
So we want to go.
What we're gonna do today is we're gonna do the ankle in a standing position.
Standing position.
Here.
Yeah, right here. Okay.
All right. So let's bring the ladder up.
So do we want to?
That's good right there. Perfect.
Stand on it.
Just stand completely on the ladder here. Okay. All right. I think everyone could see there.
You want to see that right?
That's perfect. Okay. So what I'm doing here is we're now gonna work the ankle in what I call a weight bearing position. All right. Now I'm asking his body to pretty much use all of his body weight.
And
I
put it
wanna
down
see
here.
Right there is good. Yeah, you're fine.
Okay.
We're working again on the ligament to the side, on the outside ligaments. This is the one where the majority of people injure their ligament. He had a typical ankle injury. So we're gonna see. This may hurt a little bit more than when he was last week laying down on the table for the simple fact that he's putting weight on it. But we want this kind of pressure on it because we need to challenge that ligament. We can't just let it be on a passive state, okay?
Oh, wow.
All right, and let's see how he does now.
Ooh, whoa, whoa.
So he's gonna sing for you again, guys.
It's not that bad though. It's not that bad. It's not that bad at all. Not that bad.
So he's tolerating pretty decently. Is there gonna be pain? Of course.
There is the pain right there. That
so
is.
There's a little spot in here where there's still some ligament pain, but we gotta get rid of it. That's it. This is the way that he is gonna be able to do all of his workouts with confidence, not thinking in the back of his head, oh, is my ankle gonna give out on me again? Which is the concern that a lot of people have after they do after they sprain their ankle.
Okay.
Am I gonna sprain this thing again? Is it gonna be a chronic thing? And we don't want this to be a chronic thing. We want to fix it. We want to heal it, and then you're done. All right. I myself, I'm a soccer player, and I've had a lot of experience in injuring my own ankles. All right. I've had one of my colleagues, Dr. take care of me, and he is the one that taught me a lot of this work. And we've helped a lot of athletes, a lot of soccer players heal from their ankle injuries, and we can do it fairly quickly.
Oh!
So
right on the side, right there, doctor.
Right over here, right?
Yes.
Yeah. So he's feeling this ligament pain.
Well, not there, not there. More to the other side.
This part.
Yeah,
here.
it's right there.
Yeah.
Everything is.
It's,
Oh, you see that right there?
That's it. So this hurts. This is I'm gonna tell you this therapy is painful, but it's very effective. So you want to get back to your sport. You want to get back to playing. This is the way to do it without taking 4 months off of your regular workouts. The biggest mistake people make is they think that they're just gonna rest it out. And if you're not gonna do anything except just go walking, go shopping, etc., you'll probably be okay. But if you want to do your sport, if you want to run, if you want to do CrossFit, if you want to do kickboxing, if you want to do any of these other events, your ankle, this injury will follow you, and it will haunt you. Okay.
Yes.
So you do not want to be haunted by a dumb injury like this that has solutions. And we're almost done here. Yes, this hurts. You got metal right on the ligament. All right. There's not a whole lot of meat in here, guys. So this is something that hurts. All right, now we're gonna do the pressure points. That's his favorite part of the afternoon. So here we go. Ready? And 5, 4, 3, 2, 1, 0. Okay, we're gonna do a couple more here. All right, Gizzy, how you feel?
No, that one is good. That one is good. That one
no
is very
pain
good.
here. All right.
No
so
pain there.
this part of the ligament is in really, really good shape now.
Correct.
So
it's right
this
there.
piece of the ligament. Now,
right there.
Any pain here?
Yes.
All right. So I'm gonna come around. Okay. We gotta get to this part of the ligament. All right. So you guys can better see. This is where I'm targeting.
Oh yeah, it's right there.
Right in here. He's got some pain.
No, right on in the bottom, and a little bit all lower.
Lower.
Right there.
Okay. All right. So actually, you gotta come around. All right. Now. So here we go. 5, 4, 3, 2, 1, 0. Okay. We're gonna do one more of those, just slightly over. How's this one here?
Oh, coño.
That says it all. All right. And here we go. 5, 4, 3, 2, 1, 0. And we're gonna give him a bonus one here. All right, here we go. 5, 4, 3, 2, 1, 0. All right. So this is pretty good enough for today's visit. All right. So you handled it well. Again, today was more painful because we're weight bearing.
Okay.
But we need to put his ligaments to test. We gotta challenge them, and this is the way that they're gonna get well. So the last thing we're gonna do is laser therapy. And actually, you did it.
I did that already.
So he already did his laser therapy. That's putting those two things together will help him accomplish his full recovery.
Okay, so you still recommend I go to CrossFit today or not?
He can go to CrossFit. There's no problem over here.
Okay,
This is just again modify the weight. He's doing pretty good. Has he not been walking well? Had I seen a lot of ligament issue? Had I seen a lot of swelling? Then I would tell him to stay off. But he seems that. This is almost about 80%. So.
Yay.
All right. Thank you for watching, guys.
Yes, thank you so much, guys. Dr. Alex, again, 83rd
and Kennedy
Boulevard.
North Bergen.
Go to his Facebook, Dr. Alex Hernandez, Chiropractor. I'll post all that information below so you can go and like it. Anyone around this area that needs a good chiropractor, as you can see, it's all about education, making you feel comfortable and uncomfortable in certain situations. At the same time, right? I'll see you later. GizzyCredit. Another great session here at Dr. Alex. Working on my shoulder to my leg right there in the bottom. Definitely something good. And I can't wait to be 100% and be back on the workout hustle and everything. GizzyCredit. See you later.